All right, today we are diving into one of medicine's most baffling conditions, complex regional pain syndrome, or CRPS. This is a chronic pain disorder where the body's reaction to an injury just goes completely haywire. It creates an absolute nightmare for patients and, honestly, a huge challenge for doctors. So, let's get into it. I want you to imagine this for a second. You get a minor injury, right? A simple sprain, maybe a small fracture. But instead of healing, the pain doesn't just stick around. It explodes into something severe, bizarre, and totally out of whack with the original injury. That is the core puzzle of CRPS. The pain itself becomes the disease. So to really understand this quest for relief, we first have to get our heads around why CRPS is just so profoundly strange. We're not just talking about pain here. It's more like a system-wide meltdown that's, for some reason, just focused on one part of the body.
Look, if there's one word you need to understand CRPS, it's this: disproportionate. A simple wrist sprain that should heal up in a few weeks. But for someone with CRPS, that same sprain can kick off this insane cascade of events. You've got over-the-top inflammation, nerves that are just misfiring all over the place, and even changes in how the brain actually sees that limb. It's like the body's alarm system gets jammed in the on position, and it's just screaming long after any real danger is gone.
And this all leads to a collection of symptoms that is, well, it's truly bizarre. We're talking about severe burning pain, sure, but also things you can see. The limb might swell up like a balloon, change color to a blotchy purple or even a ghostly white. And get this, it can feel either scorching hot or ice cold to the touch. It's as if that one part of the body is living in a totally different climate zone from everything else.
So, how on earth do you fight a fire like this? Well, the first line of defense is usually medication. But this is where the journey for relief takes a really counterintuitive turn, and it reveals two big paradoxes in how we think about treating pain. First step. You'd think for a condition with such obvious signs of inflammation, swelling, redness, a standard anti-inflammatory like ibuprofen would be the perfect tool for the job. But for CRPS, it's usually not. So why is that?
Well, it comes down to this. Not all inflammation is created equal. The swelling and redness you see in CRPS, that's not just your typical response to tissue damage. It's something called neurogenic inflammation. That means it's being driven by the nerves themselves. Your standard NSAIDs, they just aren't designed to hit that kind of complex nerve-based target, so they usually don't do much for the real underlying pain.
Okay, so if the simple stuff doesn't work, let's bring out the big guns, right? I'm talking about the most powerful class of painkillers we have, opioids. Surely they can handle this. Well, here we hit our second, and frankly, much more dangerous paradox.
This is just a critical mismatch. You see, opioids are actually not very effective for nerve-based pain to begin with. But it gets worse. With long-term use, they can trigger a bizarre condition called opioid-induced hyperalgesia. This is where the body, paradoxically, becomes more sensitive to pain. The very drug that's supposed to bring relief can actually end up cranking the volume up on the patient's suffering. It's a really high-risk, low-reward strategy for chronic CRPS.
So what in the world does work? Well, the real workhorse drugs for CRPS are often medications that were actually designed for something else entirely. We're talking anticonvulsants like gabapentin, which help calm those overactive nerves. Certain antidepressants can help regulate neurotransmitters to turn down the pain volume. And even bisphosphonates, which are normally for osteoporosis, have been found to reduce pain and stop the bone loss that happens in the affected limb. It just goes to show you, you have to treat the nerve chaos, not just the symptom of pain.
But what if, instead of just treating the symptoms, you could tackle the problem at its absolute source, inside the brain itself? The next step in this quest moves us away from pills and into the really fascinating world of, well, retraining the brain's entire perception of the body. This approach is called graded motor imagery, or GMI. Think of it like a series of brain exercises that are designed to rewire that scrambled connection between the brain and the painful limb.
It starts off really simple, like, can you quickly tell a left hand from a right hand in a photo? Then it moves on to just imagining moving without any pain. And finally, it uses a very clever trick.
This is mirror therapy, the final and frankly kind of mind-bending step of GMI. The patient hides their painful limb behind a mirror and then moves their healthy limb while watching the reflection. Now, to the brain, it looks like the painful limb is moving perfectly, with zero pain. This powerful visual illusion can actually help recalibrate the brain's distorted map of the body and start turning down those pain signals. It's just a stunning example of how we can use the brain's own flexibility to heal itself. But for those with the most severe, relentless CRPS, even that might not be enough. The next level of intervention involves some pretty advanced technology that can modulate pain signals at their source before they even have a chance to reach the brain. This brings us into the field of neurostimulation. And here, you can really see an evolution in precision. For years, we've had spinal cord stimulation, or SCS. It works by applying a gentle electrical current to a wide area of the spinal cord to sort of mask pain signals. But for the very specific, focused pain of CRPS, a newer technology has proven to be way better: dorsal root ganglion stimulation, or DRG. Instead of a floodlight approach, this is like a laser pointer. It precisely targets the DRG. That's a tiny bundle of nerves that acts as the gateway for pain signals from one specific limb. And the results of this precision are, well, they're nothing short of dramatic. For CRPS patients, this precise targeting means that a full 71% of them see their pain levels cut by at least half. For people who have been living with debilitating pain for years, that is a complete game changer. Let me put it another way. On average, patients saw their pain scores drop by 64%. I mean, just think about what that means for someone's quality of life. That's the difference between being stuck in bed and being able to function again. That is the power of targeting the exact right part of the nervous system. So, okay, we've looked at medications, we've looked at brain retraining, we've looked at neurotechnology. But the real answer for CRPS, it isn't any single one of these things. The true path to getting relief is an integrated one. Yeah, the consensus among all the experts is that a multidisciplinary approach is the only strategy that really works. This means you're combining physical therapies to get movement back, psychological support to handle the huge mental toll, and even innovative treatments like nerve blocks or low-dose ketamine infusions for the most extreme cases. It literally takes a whole team: pain specialists, therapists, psychologists, all working together. And this really brings us to our final thought. For a condition as incredibly complex and multi-layered as CRPS, maybe the whole search for a single magic bullet cure has been misguided all along. Maybe the real solution is something more like a symphony, a carefully orchestrated, highly personalized combination of treatments, all working in harmony to quiet the noise, restore function, and ultimately give patients their lives back.